The doctors at Barnet Dulaney Perkins Eye Center are recognized leaders in providing state-of-the-art medical and surgical eye care in Arizona. So joining me today is Dr. Casey Guilford. Good morning, Dr. Guilford. Thanks for being with us.
Yeah, thanks for having me.
Okay, so things have definitely changed. Here we are, socially distanced, doing this interview, at least 6 feet apart. They change in your industry too. I think so many people are sitting at home right now saying, do I tend to my eyes? Do I go and get eye care during this time? Or do I stay home and just wait until this pandemic is, somewhat calmed down? What are your thoughts on that? Should people be getting their eyes cared for during this time?
Yeah, definitely. We check for every type of eye disease when a patient comes in. There's a lot of systemic conditions like diabetes, hypertension, autoimmune conditions, and even the medications patients take can affect their eyes. So you want to see your eye care provider on an annual basis just to make sure we're catching any complications as early as possible and we can intervene with treatment.
How have your patients been reacting when they do come in and maybe need to tend to these things that you're talking about? Are they a little bit more nervous? Are you taking precautions at, your surgery centers?
Yeah, I think patients are definitely being cautious, and at our clinics, we're screening patients at the front door with temperature checks. We ask a series of questions just to kind of calculate the risk of each patient. We're obviously sanitizing in between patients. Our doctors and staff wear actually double masks, and then prior to any surgical procedure, our patients are screened for COVID.
Wow, okay, so that's great. Yeah, so you're making sure they can't come in. If they test positive at all, you send them home, come back and wait till you're negative, definitely.
Definitely.
So what makes your facility so unique?
Yeah, so at our clinics, we cover the entire spectrum of eye care, so that can be routine eye exams, glaucoma, retina, LASIK. And so when a patient comes in, they're not just there for the routine eye exam. We can communicate with all of the professionals in our team and come up with a comprehensive and cohesive plan for each patient. Because a lot of times patients aren't the best historian. So when you're within one clinic and all these doctors are all communicating, it's just a better outcome for the patient.
So you literally are a one-stop shop. So people could come in, they get diagnosed with this, then you send them over here and they get treated over here within house, basically.
Yeah, and we schedule appointments with all the different providers, and we're all on the same platform and electronic medical record system, so none of the information is lost in communication of the plan for each patient.
That's so nice. I know when I go to doctors, it's like, fill this paperwork out here, now contact this person. And you're right, sometimes I'm not the best historian myself, right?
Yeah.
We forget, we live these elaborate lives that we forget certain things in our lives. I was reading that you do implantable contact lenses.
Yes,
what in the world is this?
Yeah, so for some patients who aren't candidates for LASIK, so whether it be that their corneas are too thin or their prescription is too high, there's another procedure where we can actually go in and implant a lens that can correct their level of nearsightedness and some astigmatism and have excellent visual outcomes with that.
Wow. And so it's indefinite?
Yes.
Unbelievable. That sounds wonderful to be someone who's lived with contacts since I was like in 7th grade. Yeah, that's great. What exactly is glaucoma?
Glaucoma is a condition of the optic nerve. Generally, there's no symptoms, especially early on in the disease, so it's really important to have your eye care provider examine you for that each year. Basically, if intervened and we initiate the treatment early enough, vision loss is very preventable. You don't want to wait until you have signs of vision loss because the vision loss is irreparable.
Okay, so is this something that would be age onset or something that even younger people are getting?
It is more common in elderly populations, but it doesn't mean we aren't seeing patients younger and younger with it. Yeah. So it's still very important. Even patients that have excellent vision, it doesn't mean that they might have something going on in their eye that would be excellent for the doctor to pick up on earlier rather than later.
Yeah, absolutely. Again, why is it so important for people right now to keep up with their eye care?
Yeah, we want to make sure that patients are, have a high quality of life even during this difficult time, and vision and their eyes are very important to most people, so we just want to make sure they stay that way and they stay healthy.
Awesome. Thank you so much. Thanks for this great information today.
Thank you so much.